Hi, I'm Dr. Gwen. I'm a clinical psychologist who's been empowering disabled individuals, their families, and their support systems for over 20 years. If you haven't already, please consider subscribing to my channel, where I curate tools, share mindsets, and promote habits to help the neurodiverse community thrive. Also, hit that notification bell so that you don't miss a thing. In this episode, I interview Dr. Hilya Tehrani, a clinical psychologist and founder of Connected Strides, a psychological practice dedicated to the therapy and assessment of individuals with autism, ADHD, anxiety, and trauma. Hilya and I talk about the practice of applied behavior analysis, or ABA, and deconstruct the best and worst applications for ABA in the treatment of individuals on the autism and disability spectrum. As two clinical psychologists who have been in this field for a while, we can't help but explore the importance of person-centered treatment, the role of trust and respect in a therapeutic relationship, paying attention to individual differences, and delivering treatment with intentionality. Having a conversation with Hilya is always a grounding experience for me. Her expertise and deep care for what she does always shines through. I hope you enjoy this conversation with Hilya. Hi, Hilya. Welcome to the channel. How are you?
I'm good. Thank you so much for having me.
Of course. I mean, you and I go way back. We've known each other for a very long time, lucky me. But our audience might not know you. So can you introduce yourself and tell us who you are?
Sure. I'm a clinical psychologist. My focus has always been working with kids and teens and their families, and really predominantly working with the neurodivergent population for over 20 years. From the time I did my internship, at that point, my focus was on a lot of testing, psychodiagnostic, neuropsych testing. Once I completed that, my postdoctoral training was actually in your practice, being able to really focus on working with the autistic community, as well as other, neurodivergent, ADHD, learning disability, profile kids and teens, and really just finding ways to empower them and know how best to work with them through therapy and assessment.
Yeah. And I think something, and today, our topic or conversation is really going to be about ABA, or applied behavioral analysis. Mm-hmm. And this is, we go way back in regards to the application of ABA principles, or ABA, as it's applied in real time, and how theoretically what it looks like and what happens in real time. And so, I'm hoping for us to get into that today. And you do have an extensive background in ABA. So tell us a little bit about that, just so that people know your ABA background.
Sure. So it was sort of this dual path that I was on, right? So simultaneously with, going through my doctoral program and all through internship, postdoc, when I was licensed, even for about 10 years after being licensed, I actually worked at as a clinical director at an ABA agency, overseeing them providing in-home and school-based ABA services for kids and teens with autism. And so I really got to be kind of on that side of it. I became a board certified behavior analyst at the doctoral level. So I really kind of learned the ins and outs of doing ABA, overseeing ABA programming. But of course, also had my foot on the clinical side and looking at things from a little bit of a different perspective as well.
Yeah. I mean, I think there's this misconception that ABA or behavioral types of therapies can't exist together with being clinical psychologists, right? And you and I have had this conversation about how do you bring clinical psychology, how do you marry clinical psychology with ABA or behavioral principles? They go hand in hand in many ways. But how do we focus on the relational parts of ABA, which is really not something that's discussed, because in many ways, many individuals and agencies that are grounded in ABA practice don't necessarily think about the relational aspects of therapy. And so this kind of marriage of your behavioral background, ABA background, and your clinical psych as as a licensed psychologist, really give you, I think, a different perspective about how wonderful in many ways ABA can be and how it doesn't fit for some things.
Correct,
Yeah.
correct. And I really felt like having the clinical side, it was helpful in that the whole time I was at the agency, really my focus was, how can I bring that sense of understanding to all of these providers? Because it was such a great way to reach, you reach hundreds and hundreds of families, whose kids need these services, who wouldn't otherwise be able to access, any other kind of form of therapy without what's offered to them through, insurance or regional centers. So I really was very passionate about then, okay, how do we help the people who are, in the homes, in the schools, understand ABA in a little bit of a different way of what we talk about as being more person-centered, really being about the child and understanding the child and their unique and individual differences and starting from that place.
Yeah. Yeah. And even just saying individual differences or those, that's a lot of times that terminology is more aligned with the floor time DIR terminology. But it's just good practice, right? Especially as psychologists, we think about lots of different factors that help an individual in their planning of their treatment or their interventions, that we have to be person-centered and individually focused. Hilya, for those out there that are listening, can you define just very briefly what ABA is, just so that, we're kind of all clear and on the same page?
Sure. So ABA, goes way back to initially the work of Skinner and Pavlov, and it was all respondent conditioning and operant conditioning. Basically, was a way of teaching where you either can learn by association or you can change behavior by strengthening it through reinforcing it, or withholding reinforcement weakens behavior. But then through the years, in the late 60s, Dr. Ivar Lovaas, which, has kind of become synonymous with the world of ABA and, excuse me, and DTT, he started to use this particular way of teaching with kids with autism, right? And he started to do imitation training. And really at that time, the focus was on kids who had really significant self-injurious behaviors, dangerous behaviors, and that's where the history of ABA also becomes a little bit, problematic, right? At that time, he was using things like punishment and electric shock and to work with some of these kids, and that that is its history. That's where it started. Fortunately, we've come a long, long way from that. Hopefully, yes. And then just over the years, he did a study where he basically compared kids who had 40 hours of DTT, this intensive form of intervention, with a group who had less than 10 hours and a control group who didn't have any kind of ABA or DTT, and found, he reported these findings of, 47% of these kids who had the 40 hours a week of intervention were no longer, autistic. They were no longer distinguishable from their peers. And and that became really kind of a groundbreaking study that started to be replicated through clinics and different universities. And eventually by the late 90s, ABA had really become established as the primary kind of evidence-based form of intervention that was, kind of sanctioned and approved to be provided for all kids with autism.
Yeah. Yeah. And, for those of us that have been there in that ABA place, because, that was my initial training as well, decades ago. And that's where really I started. I started as a one-on-one. And that's how I got introduced to the field. It felt there was something really lovely about how formulaic it was, it was very organized, clean, if you will, in regards to you do this, you expect this, you reinforce it negatively or positively, and you're out. And ta-da, it's done,
Yeah.
Yeah. And I think as I progressed and myself grew as a professional, and then my the kids that I was working with started to age, as kids do. And I started to realize how that very simplistic way of reducing behavior and what you see, because ABA is very much you act on observable behavior. It felt too simplistic and reductionistic. And it wasn't capturing, for me anyway, the wonderful pieces of emotionality and how emotions inevitably play with the nervous system. And then it, gets in the way of production. How do we then produce behavior for any human being for that matter when we're overstimulated, when we're distressed, when we're upset, when we're really, really happy, when there's any big emotion happening. I felt like that was really hard to control, if you will, because I think that's a good word when we talk about ABA in general. And that, there's just so many things that people are so complex and that it was getting difficult for me to just rest in the ABA or the just purely behavioral realm. I was searching and needing other types of integrating other types of theoretical information in my practice, and that's just I look back and when I know I can use a pill cutter to make a Skittle go 8 ways, things are serious. But I think that the ability to reduce things down to that request, the expectation, and then the reinforcement, those kind of 3 quick phases, if you will, in teaching in ABA, more like generally anyway. It was easier to probably measure empirically. So I know ABA has a ton, and there are many areas, maybe we can get into this. There are many areas in which ABA is really helpful and productive and positive and a great tool, if you will. But it does have a lot of empirical and scientific support to, back it up. Hilya, what would you say the main goals of ABA are as a framework?
Yeah, so ABA really is about being able to objectively measure and track the interventions that you're doing, and that's a big part of it, right? Is being able to take data and really see if what you're doing is working or not. It's really about changing behavior, either directly or through manipulating the environment, setting up the environment in a way that's going to lead to an increase or decrease in behavior. There is this, fundamental assumption, which kind of overlaps with things that I talk about even clinically, that all behavior has a purpose, right? So I think the difference is with ABA, maybe it looks at it a little bit more at a what I would maybe say a more surface level, that behavior has a purpose, but from an ABA perspective, the purpose is going to be getting attention, escaping or avoiding a situation that's unwanted, or a task, getting access to things that you want, whether it's a tangible or an activity, something you really want, or kind of they lump together this idea of just sensory-based behavior. And those are kind of understood as those are the functions that behavior serves. We have to understand the functions in order to know how to approach, what kind of interventions to use, and that's the main focus of it. There's lots of techniques within ABA that are just kind of things that good teachers do, that parents often do. If whenever a teacher gives lots of attention to the child who's sitting well in their seat and raising their hand to ask a question, they're like, "Oh, I love the way you're sitting. I'm going to call on you because you raised a quiet hand." That's reinforcement, right? We're giving attention to behaviors that we want to see. Anytime if you're helping your child and you're giving them, just a little bit of help by, pointing at what they are supposed to be doing, or, giving them like a little hint, you're prompting. If you realize you've been helping a lot and you're trying to pull back and do less so they can do it more on their own, you're fading prompts. These are all behavioral techniques. If you've ever said, eat your veggies and you'll get your desserts, that's the Premack principle. So, on one hand, I think of ABA, it's not really all that, this, other thing that only ABA technicians do, and we kind of, have to just throw out because it's problematic. There's so much about it that is useful, that we use in every day, that we actually see, as you said, there's a ton of research, in part because it really lends itself to research, because everything you're doing, you're gathering data on it, right? So there's a ton of research in which it shows that you can help improve the behaviors you want to see. And by behaviors in ABA, we're really looking at all kinds of things, right? It's like self-help skills, it's adaptive living skills, it's communication, socialization. It's not, sort of just behavior in the way that we would consider, like tantrums or such, but it's really anything that's observable and measurable. So that's what the field is all about, is being able to kind of strengthen and increase those kinds of things that we want to see more of, but also reduce the more problematic, what they call behaviors that are interfering with learning, right? If a child is having, tantrums anytime they're sitting at a desk in a class, trying to learn, they would say, okay, that's interfering with them being able to learn. So how do we reduce that and increase their time of being able to sit and attend?
Yeah. And, this is where I feel like ABA offers a framework, which is so lovely, which is in skill building. And doing what I do today, where, I'm specifically working with adolescents and adults, it really does come down to skills, like skill execution, right? And if you can't execute the skill, then we just know we need to back and support. I mean, it's like there's no judgment there. It's just making sure that, adults and adolescents are healthy, safe, and happy. And so, we want to make sure that's happening. This is where I feel like ABA offers a very nice framework to understand how skills are built, how habits are built, what we pay attention to, and really focusing, I think, on the minutia of the interaction. I'm going to pay attention because I want to reinforce this particular behavior, or I'm not, or I'm going to ignore that, or I'm going to do something else so that that behavior kind of goes away, or we shape something. For example, we make something we approximate something in the beginning, and we bring it to some kind of mastery, if you will. Right. I feel like ABA really does that in a very strong way. And I love what you said, because maybe, when we talk about, maybe what we can think about is ABA or behavior, these kind of principles and techniques and strategies as tools in a toolbox, right? It's not the only ABA. I mean, I think that can be the difficulty sometimes, and I think way back when there was a very, very serious kind of, what's the word? A very serious a disagreement between theoretical orientations for how we were going to provide intervention for children with autism, right? And I don't think that we need to be exclusive. Like, they're not mutually exclusive. DIR, floor time, does not have to be mutually exclusive from ABA. If we borrow and use tools that make sense for the client or the child or the adolescent adult in the moment, then we're really using, we're really being very comprehensive in the way that we can address the support of somebody, right? So maybe, Hilya, maybe what we can do is talk about some of the best applications of ABA. Where do you see ABA as being strong? And what I mean by strong is where it shines, while also respecting the individual, because I think that's another piece. We can maybe talk about that down the road, but where it does nod to the individual differences of the person. It is respectful and collaborative. Like, where do you think ABA shines?
Yeah, so I'll start with my very favorite thing, which is in behavioral terms, it's called getting a baseline and then shaping or changing behavior, right? Essentially, to me, that is meeting the child where they're at, like really honing in a very clear, specific way on what is their skill level at this point, whether it's with communication or play or engagement. Just kind of like, I'm going to stop, I'm going to really put the lens on understanding, seeing where they're at, and knowing that that's our starting point. And being very mindful of if that's our starting point, the next step, if a child is using, say, scripted language, the next step is not going to be, let's engage them in a back and forth conversation, right? It's okay, scripted language is what they have right now. So how do we make that a little bit more meaningful? What is just finding these really minute, small little steps where we can gradually move forward. Being in that, zone of proximal development, I'll throw in my my clinical kind of an understanding of it, right? Where you're challenging them just enough so that you're making this forward progress, but not to a point where they're frustrated or they're going to give up. And when they can meet that, just right challenge, reinforcing it, right? Letting them know that, giving them that feedback of like, this is great, you're doing it, this is what we want. Because that feedback, again, is powerful. We know that it changes behavior. When you know what's expected, when it's really clear, and when what is expected is within your range of things you can do, maybe with a little bit of extra effort, maybe with a little bit of prompting, with a little bit of environmental support, and then you can meet it. There is some internal satisfaction, and it's fine to also add this external reinforcement because we're trying to build up momentum. And I hear that a lot too, right? Just, how is a child going to internally have the sense of, motivation if we're constantly throwing reinforcers at them? Well, and that's one of the great things I learned from ABA is you do reinforcement very deliberately. When you're first learning a task, as for all of us, we're learning something new. We know it takes a lot of building up momentum and getting through the frustration and, kind of persisting all those great growth mindset things that are challenging. You need a little extra reinforcement. We might do that for ourselves and say, hey, I spent the whole day skiing. I'm going to treat myself to some hot chocolate, right? Like there's nothing wrong with that. But over time, when you get really good at it, the activity in and of itself becomes reinforcing, and you can fade reinforcement, right? So just having reinforcement in place does not in and of itself mean it always needs to be there, that it's going to be something that kids rely on or individuals rely on. So I think ABA is good about kind of recognizing when to deliver it, how much to deliver, and when and how to pull back. And how to pull back in that we have a lot of tools for how to pull back, right? There's different ways in which you can reinforce. Some of them are much more intrusive and some are much less intrusive and can sort of gradually shift towards being kind of more internally driven. So those are a couple of my favorite things about ABA.
Yeah, I love that. I would love to just maybe sit with this idea of intentionality and deliberate, like how deliberate things are. Because, when we talk about intervention and treatment, we want to be intentional about what we're doing. And, I think all theoretical models, all applications can suffer from getting into a rut or not being intentional about what you're doing. Even if it's, I'm going to intentionally do nothing. Right? That's really hard, right? I'm going to intentionally not say anything, not do anything, because I have in my mind that not doing something is going to lead to someone else or the person that I'm supporting, working with, do whatever they need to do and find that they can do that on their own, or to approximate it on their own, or to motor plan that on their own, or whatever that is. There's so many factors, right? So I love that. And I think when you're deliberate and you're intentional, what happens as well is your expectations, and this is something that you touched on, is that your expectations are set reasonably. What am I expecting specifically out of this situation? I think therapeutically, as psychologists, when we're offering a therapeutic or a clinical press to our clients, which we often do in our work, we're really intentional about how intrusive, how hard, or how easy that press is, right? And so I think a lot of times, this is where our ABA training gave us a framework to understand that, and you're right. You can use prompting as a way to fade. You can use reinforcement in a different schedule to fade, to not, I mean, there's so many different ways you can work with that. Yeah. So ABA being really nice in providing that structure and framework for hitting your target, or at least making your best guess about what target you should be hitting, right? And being observant, maybe, just continuing to collect data, be observant, and let that give you a guide about where to go. Again,
Yes.
I like behavioral principles for skill building and what I would consider tightening. So whenever I need to tighten something up, something's a little bit awry, like maybe my client's experiencing something and it's kind of taking over their life, It's like, oh, I need to contain that. I need to help the client contain that. The behavioral aspects of not just ABA, but of psychology are really helpful. Hilya, let's go to the opposite end of this, which is, where do you feel like ABA is maybe not the best choice, or those kind of behavioral principles are not the best choice maybe for outcomes? What situations would that be?
I think it applies to ABA. I actually think it applies to any discipline, is whenever you get very rigid about how something is applied, right? If you kind of come in with your idea, and you mentioned earlier when we were both first getting trained, it was very kind of satisfying to come in with a little logbook of, this is the goal I'm working on, and every time I get a correct response, I mark it, and I can see, you have nice little graphs that show progress. And so in that way, the structure of ABA can be very satisfying, very containing, as you said, and it can be wonderful in that way. But, if we are very rigid with how we apply it, if we don't allow for just the human, tendency to have an off day, to, have been able to do something one day, but not the next, to say, well, we were here yesterday, and so if we can't hit it today, we're just going to keep at it until we hit it. Like, that's all rigidity, right? That's all being like really set on going with the data, as opposed to with just what does it feel like today? How is it different? How are you showing up today? That's going to guide what we do. And within that, I listen a lot to. I work a lot with the autistic community and autistic adults. Unfortunately, there's been a lot of negative experiences, right? And we can't discount that. Those who had kind of years and years of ABA, which was unfortunately very focused for a lot of years, and I think maybe in some places still is, on compliance. Sort of like the adult comes in with their agenda, and sort of the entire goal of the session is getting the child to comply with whatever that preset agenda is. I think that's problematic, because how can an individual develop their own inner voice when they're spending 20, 30 hours a week kind of in this mode of doing what others are asking of them? There's, obviously it's, as adults, we hear a lot about how it made them so vulnerable to being taken advantage of, even, sexual trauma. There's really problematic things that we have to acknowledge that have come from it. And, just this whole idea of like everything you do gets reinforced. And so that, carrying guilt of, I can't just do something that I enjoy if I haven't sort of worked for it, right? I have to do a task in order to earn what I want to enjoy. And none of us want to walk around feeling like that. So, why would we impose that on the autistic individuals? And, just not really respecting differences. I think that's, that continues to be what I strive for, and really, as I work with others and even others in the ABA field, is again, understanding everyone has differences, especially if you have autism. Your sensory profile is going to look a little different. Your the way you process information, the way in which you're impacted by your environment on a day-to-day basis is a visceral thing, right? It's something that they literally have to kind of work through on a daily basis of kind of the sensory bombardment and difficulties. Living in a world that's created for neurotypicals, in a world that has these expectations of good learning involves having a quiet body or calm body, and so there's all of this stuff that they have to work against, And so it doesn't help for us to go in and just say, okay, so that's our goal. We're going to work on you having a calm body in order to learn, as opposed to, no, what does your body look like when you're learning? And that's very different from what I expect learning to look like. So, those are all problematic things. And then when I hear parents talk about being told, say their child is scripting and a professional tells them, we really don't want scripting. Let's just put it on extinction. We want to ignore it. As opposed to, okay, but that's serving something. Maybe that is the only avenue through which that child is connecting. And for autistic individuals, their avenue of connection is not necessarily even going to be verbal, right? It might be in a lot of other ways. So self-stimulatory behavior, stimming is something I always kind of cringe when I hear someone trying to do away with it, or kind of like we can't stim, like it's not something that we want, let's reduce it. So I definitely acknowledge that those are problematic. But again, I think we can still use ABA techniques as long as we recognize that those are differences, that it's not our place to do away with. It's not our place to do away with special interests. Actually, we should join in special interests. We should use them as an avenue for engagement and connection. And I feel like in that way we can be impactful and still use our behavioral tools when necessary to change the environment. I think that's one of the great ways about ABA is it doesn't look just at what you can do directly for the child or what a teacher can do or a parent can do, but also how do we set up the environment proactively in a way that, is predictable, is maybe there's lots of visuals, there's just reminders in these ways that help to kind of just make it more structured and organized and predictable. Those are wonderful things, and there's no reason why we wouldn't want to use those, as long as we're taking the unique child who's in front of us into account.
Yeah, and I love that. Not only if we're doing an environmental analysis, can we set that up in a way that can serve the person in their learning profile, but we can also evaluate environments in which going to that environment, we're going to need to back in support. Or we're going to need to back in some skill building, right? And I face this a lot as I'm helping my clients prepare for work or college or vocational program or starting internships and coming into the world in a way that's not so controlled or manageable, where we can control it. The question is, what are they going to need to be as successful as they can be? And that maybe we look at the demands, right? And in our work, we call this demand fade in, but the idea of, how do we look at everything that's going to demand something from this person? That's a sensory piece, how sensitive they are, maybe, how overwhelmed they get by external stimulus. I mean, all of this. And that demand is maybe not only just the job at hand, but it also might be how long they're there for. How do we bridge those gaps and connect those gaps? What I love, Hilya, there's a few things that just really resonate with me. I would completely agree. Anytime we become rigid about anything, period, right? It's a problem when we're not, whether it's a mindset or an attitude, or a thought or a behavior. Anytime we become rigid, we miss stuff, right? The other thing too is this idea of compliance squashing the inner voice of a person, or compliance really not helping someone build self-awareness. And as I think about the most important skills in my mind when I'm supporting adolescence in transitioning to adulthood, is I'm thinking about the social emotional learning competencies and executive functioning. And that self-awareness competency is the foundation, and it serves as the foundation for where behavior and thoughts come from. Right. And so if we're only focusing on compliance in ABA programs, in the old days, we used to call this drill and kill, like the drill and kill programs. Right. And I'm not trying to be offensive. It's just that word just tells you what you're doing. You're at a table, you're drilling things, you leave, you let the kid leave, you come back, you drill things, you let the kid leave, right? And it's, while that might be a starting place for some things, is definitely not the best place in which we learn skills that are applicable and usable in everyday life. But yeah, compliance squashing self-awareness. I'm uncomfortable. I don't like this. And then now I'm trying to teach my adolescents advocacy. Well, they don't even know the language or the fact that they're uncomfortable. So yeah, they're set up for exploitation, and heaven forbid some of my clients are pleasers. They want to please you. They want to do a good job. They want to do these things. And then they're blowing past all the signals of like, this is not right. This is not good. I don't like this, and we never taught them the ability to collaborate and be problem solvers in their environments. And this is what, for me, I'm really looking for any kind of ABA provider these days that are working with adolescents, and I mean all the way down to 10, 11, and higher and older, is how person-centered are you, and how much of a collaborator can this child, adolescent, teen, young adult be in their treatment? They should be setting their own goals.
Right.
They should be talking about what reinforcements they want. They should be talking about the prompts that are comfortable for them. I mean, I have clients, you go physically prompt them, it's aversive for them, especially my adults. You don't want to be touching adults, I mean, it's so interesting. But I love that. Like, yeah, compliance shouldn't be our goal. And if the child is not compliant, why? What is happening there? So that we can look at that. Yeah, I love this. I love, everything has good and bad, with it. So I love that we're kind of unpacking that and deconstructing it, because I think you're right. There are parts of ABA that are lovely and can be applied. And even the lovely parts maybe not be applicable in a certain situation. Much like our clinical work, there are times when we shouldn't be insight oriented. We shouldn't be opening up conversations about things that we know our clients can't then cope with or self-soothe about. You know what I mean? Like, it's the same deal. Hilya, I mean, I think we've hit this, but maybe we can summarize this. What are your suggestions or your ideas on how to deliver, ABA, while keeping it relational, respectful, person-centered, collaborative? What are some of your suggestions for that?
Sure. So I would say we always begin, as we do in clinical practice, you always begin with the relationship is paramount. Even within ABA, you begin by building rapport with a child. They have to get comfortable with you. They have to have fun with you. If they're not kind of invested and wanting to hang out with you, like, how are you going to be there to kind of support them, co-regulate, prompt them, whatever you want to call it, through those difficult moments? So you really have to establish a good relationship. And that's every good ABA therapist that I ever worked with. That's what made them shine, was that they knew how to connect with a child. And that's just fundamental. And then, the next level really is getting the child that you're working with, because, that saying of, if you've met one person with autism, you've met one person with autism, right? It's like every individual is different. We have to be really mindful of what do they bring to the table from a sensory perspective. That's where I love collaborating with OTs. I think the best ABA providers are the ones who are actively working with OTs and incorporating, those great sensory strategies, helping the child learn how to incorporate them within the sessions, right? Like, oh, it's seeming like you're needing a break. What's a good break for your body right now? And let's go do that. I mean, that's going to build in self-awareness. Within the structure of an ABA session, you can have a structured session, but you can take breaks and bring in those strategies that has been recommended. So really understanding, again, what do they need? Because our physical self is, again, it's kind of fundamental, right? If we can't regulate, you can't get to anything else. You can't all the skill building and learning things and language and symbolic thought and play. Those are all kind of like the icing on the cake once you have that well-regulated calm body. So you can't come in and just kind of drill and, get to what needs to be done through reinforcement alone if you're not mindful of, this kid didn't sleep well last night. Today we're going to spend most of the day just kind of, playing outside and doing obstacle courses, because that'll still work on executive functioning, because it's, planning and, going through like motor planning and, following a couple of step directions and whatnot. So you really have to, again, see the child for where they're at, what is their processing style, what's their learning style, developmentally, where are they at, right? Just because you have a 10-year-old, you're not going to kind of impose certain 10-year-old expectations. Because again, with ABA, we look at, what are all the different skill sets, and there's going to be all these peaks and valleys. So where there's the valleys, we're going to kind of meet them closer to where that is and start building from there. And really just the collaboration with other professionals, I think, is huge. Again, none of us are good at everything. And we, and 20 something years into this, I know you and I are constantly still trying to learn and trying to, I call you up, like, okay, what do I do? How do I get a good sense of what's going on here? So being collaborative and always understanding there's intentionality behind behaviors. I think that's so key, that we never just go to this mode of, this behavior is really disruptive, or these tantrums are, they're lasting 45 minutes and they're, these meltdowns are disruptive. So we'll ignore them and put them on extinction, right? Like, to me, it's about understanding why are they happening. And I know from an ABA perspective, again, they're going to look at functions of behaviors. As a clinician, we can dig a little bit deeper. But, in general, I think if we're only focused on reducing behaviors or predominantly focused on reducing behaviors, that's problematic. I'm always looking for providers who are really big on, most of what I do is proactive. Most of what I do is skill building. Yes, there will be some simultaneous, as I build these skills, I'm going to look at how the behaviors are reducing, and maybe we're tracking that. But again, there's a skill missing, and we have to figure out what that is. And we have to support the child to be able to get there. And that's why they're exhibiting the difficulties that they're exhibiting. And again, one of my favorite sayings is, kids are doing the best that they can with the tools that they've got at the time. So that's not something to be punished. It's not something to be ignored. It's okay, what other tools do we give them, or what environmental supports do we give them? How do we structure things by working with the teacher and working with parents, and really kind of having this collaborative team approach, so that everyone's on the same page with having appropriate expectations, and giving the tools where they're needed.
Yeah, absolutely. And I love some of that, like, kind of base assumption. Like, there's some base assumptions that you have to make, going back to, we're doing the best you can with what you've got at the time. Like, that idea, our assumptions about our work and people is best intentions working as hard as they can, and when you come at it from that point, then the answer is skill building or support, or both.
Right.
Those are the only two answers. Right. And I'm not saying that there are times when there is intentional or malicious behavior. I'm not saying that never happens. That does happen. It's still communicating something to us, usually anger, frustration, irritability, something along those lines. And we, have to try to understand what that is. But, the other piece here too, Hilya, is the idea of regulation. And that idea of my body and my mind and my brain really is ready for learning. Like, learning is the very last thing we do. Like, we got to make sure all this other stuff is cared for and provided for. And I do feel like, as I was listening to you talking about how to deliver ABA in this way, it sounds a lot like the framework of DIR floor time, right? How do we understand someone's neurological profile, their sensory profile, their processing, their language, their developmental levels? That, DIR floor time provides that framework for you to understand. That's how they help you understand and get, if you will, like, as you said, who you're supporting and who you're working together with. And that's just something that I think is so important because there's so much that's unsaid. I didn't sleep well last night. My medication's off. I haven't been eating well because I'm a really picky eater. I mean, whatever that is, how does that play a role? So Hilya, as we think about all of the kind of ABA techniques and strategies, what would you say is one of your favorites?
It's starting with a good baseline and just taking small steps from there, and really being, being intentional. We talked about that. Just kind of recognizing where kids are at is I think it's important for parents, for us as we're doing the work that we're doing, and then just not jumping too quickly, right? Being able to know that, okay, we've met this goal. It doesn't mean we like just quickly go to the next step and the next step. Being able to kind of like, again, ABA is really great with that. Is you learn something and then you can kind of stay there, stay there, strengthen it. This whole idea of like, if you fade prompts too quickly, you might see kind of skills falling apart. It's, very often if we're not mindful of that, we sort of get the gains and we're like, great, that one's done. Let's keep going forward. Whereas, you kind of have to let things settle. You have to allow for time. You have to very slowly and deliberately say, okay, if I pull this support, let me just observe. And again, this is from ABA, being able to be very observant of maybe I'm not necessarily taking data of, how frequently is a child, maybe getting dysregulated when I'm interacting with them, but I am mindful of, is what I'm doing having an impact of kind of promoting more of what I want to see, or is what I'm doing kind of making us go in the opposite direction? And then that's how I know if it's working or not, right? That's a very fundamental ABA principle, which I think is wonderful. Just this idea of, we don't always know what tools are going to work for a particular child, again, because of their unique differences. We can try things, we track them, and we see over time, is it leading to improvements? And if not, that's okay. We have to kind of, stop, take a moment, kind of regroup and say, okay, let's try something different. And then just see how things pan out over the course of a couple of weeks. That's one of my favorite things that I do with parents, right? Kind of this idea of like, you don't have to know exactly what's going to work and use that. You can try it and just watch and see what happens. Are things getting better? If in a couple of weeks things seem to be getting better, then you're probably doing something that's helpful. If they're getting worse or you're not seeing any difference, well, then maybe it's time to let's try something else. Let's brainstorm and come up with some other ideas. So this sense of like, it's not imperative that we get it right, and we don't just have this one chance to get it right? Our behavior is a response to things happening over the course of time, and things that maintain behavior, again, happen very slowly over the course of time. And then just in the same way, will take time to reshape and change in different ways.
Yeah. I mean, I'm guilty of this therapeutically and even as a mother, where I call it getting greedy, which is like, oh my God, it's working.
Yeah.
Let's do more. Oh my God. And then now I've completely like flooded somebody, I've overshot, if you will, because I was greedy. I was hungry and greedy for the yummy goodness of what was going on and just not letting it digest. Like, the neurological systems that we work with are sensitive and vulnerable. And so we can't, they need some time. Like, it's like, back off, lady. I mean, I imagine that's a lot of time. I say that to my clients, like, tell me to back off. Tell me I'm going too fast. You have permission to tell me, hey, like, hold up a second, and to allow that to happen. And so I love that. I love that. Okay, so Hilya, I love this question, putting people on the spot on this. But if you could only choose one skill to empower your clients with, that could be parents as well, if you wanted, what would it be and why?
Yeah, so it would be insight or self-awareness. I think it's kind of across the board, kind of whoever you are. I think that is the single most powerful thing. It is why I do what I do. It's to give my clients and their families the insight of, and for clients, it's, who am I? What are my strengths and stretches? What are the ways? Where are the places where I shine? Where are the ways in which the places in which I need additional support? What are environments that are going to overwhelm me? And it really just being really clear, and then and part of insight is being able to tune into your body, right? What feels like too much? What doesn't feel right? And being able to listen to that, being able to pause and listen to that and honor that. Because if we don't have that, we don't get to the next step, which is empowerment, right? If you and you mentioned this, and it's absolutely what we work on with teens, and really recognizing what is it that I need, being mindful, being aware of it, and then being able to believe in it strongly enough, kind of own it enough to be able to speak up and say, hey, this is what I need. Just like what you said in session, for a client to be able to say, whoa, we're going too fast, or I've had enough of this today. I want to do something easy now. I want to do something mindless. That's great. That's insight. That's honoring what your body and what your mind are telling you. And if you can do that, I feel like across your life, you're going to do better socially. You're going to do better in your workplace. Knowing when to take a break, knowing what you need to kind of reset yourself and come back so you can put forth your best self. Those are just so crucial, and they're big goals, right? I mean, you and I know we spend years working on that, kind of chipping away and trying to make that happen in small ways, because it's something that all of us, it's a work in progress in that way, continue to develop that.
Yeah. Yeah. Oh man, totally. And you and I both know that there's so many competencies or skills under self-awareness. And we tend to have to get very specific all the way down to, I know one of the things that I do with my clients is like, how tall are you? Mm. What color are your eyes? How much do you weigh? Like, you can't ask me that question, but I'm going to ask you this question just to help. But it's funny because a lot of times I'm like, wow, our self-awareness is limited so much that you're having a difficult time describing your body, like your physical characteristics. I can't tell you how many times my adults can't answer this question and they'll pull out their driver's license and read it to me. And I'm like, I know, but you didn't fill out that form. Your mom did, or what, whatever. But it just shows me like, oh, we need to empower you with this tool so that you can then advocate and communicate and self-manage and have relationships and solve your problems and set some goals. And, so I wholeheartedly second that skill. Anyway, Hilya, if anyone's listening to this interview and they're interested in finding out more about you, what's the best way for them to do that?
My website is the best way. All my contact info is on there. It's connectedstrides.com. Connected, like building connections, and strides, STRIDES. Connected Strides, all one word. And yeah, feel free at any point through there. You can reach out through email or phone, and I'm happy to consult. I have a Facebook page, but really my website is the main way to find me.
Awesome. Thank you so much, Hilya, for spending time here today.
Oh, you're welcome. It's been a pleasure.
Hey, you made it to the end. If you're interested in finding out more about Hilya, her information is in the description below. If you got any value from this interview, please hit that like button and subscribe to this channel. Doing so helps to get this information to others just like you. See you in the next episode, and thanks for watching.